Well, I'm going to start by just saying Dr. Yolandra Hancock. Welcome to the award-winning Ed Brown Show. And we are continuing our segment. Dr. Hancock is a pediatrician, but she is really more of a health advocate, and you are someone that wants to be connected to the family, not just the patient, so that you can have this whole world of I'm here for you, to help you, to teach you, and to be in the fight with you if necessary. And so since we're starting a second segment, tell everyone why you decided to become a pediatrician.
So I decided to become a pediatrician to address issues of health disparities. My 4-year-old cousin passed away right after her 4th birthday, really because of lack of access to care. And at the time, I thought I wanted to be a plastic surgeon doing repairs of craniofacial deformities of children who were born with birth defects. But after she passed away, the question I literally asked myself is, what good do I serve in fixing their faces if they can't survive to their 5th birthday? And at that point, I made a full commitment to being a pediatrician. And it's funny now, so in some ways I'm more of a family physician because one, the child is the center, but I connect with all of the adults in the space. But I'm double board certified in pediatrics and in obesity medicine. And in that space, I work with folks from birth through senior, right? I think my oldest patient was 88, in helping them to manage chronic diseases like diabetes, hypertension, heart disease, and weight management, all in the same space. So I get to do it all at this point.
Wow, and I wanted to talk to you, we had talked before we even started the show about, children and healthcare, well, just healthcare in general, and the cost of rising healthcare, but also about how you work with a family to be able to do all of that so that it's all consuming. So you're going to work with me, and yes, we have to work with the insurance agency, and we have to work with my chronic illness, and we have to work with other doctors, and we may have to work with Eastern or Western. How do you bring it all into one umbrella?
It requires time, right? It requires a good amount of time. And part of it is really helping people to navigate those spaces for themselves, because I may not always be present. There may be a physician who has a completely different philosophy. So it's having a clear understanding of who are all the members on this health team and what is their role. What questions do you ask of that team? So, a friend of mine, I just connected him with a cardiologist, and I gave him a list of the questions to ask, the labs to get, and the studies to request, and then what to ask for once those results are available, and then to circle back with me so that I can translate. One of my friends, she says, you're like the doctor whisperer. You can translate all this doctor-ese that these healthcare professionals usually speak to us. So it's giving folks sort of the landscape of where to go and then helping them to navigate through it. It doesn't take a huge amount of time. I mean, people are brilliant and they know what they want. They just have to have a better sense exactly of what that looks like. So as a standard, most times when you go to a doctor when you're concerned about heart disease, they will check your cholesterol, they'll maybe get you a stress test, perhaps an EKG, and send you on your way. The problem with a stress test is you have to have at least 60% of your blood vessels in your heart blocked in order for the stress test to come up positive. But by then, you're almost too late, right? So there are other things that can be done before you do the stress test. Things like what's called a coronary calcium exam, where they actually do an x-ray to look at how much calcium is in your coronary or your heart blood vessels. That's more important than doing a stress test, because then you know if it's at 20% or 40%, and what do I need to do. It's that kind of information that I like to provide to my family, to my friends, and to my patients so that they're making informed decisions. Now, with that information, not only do you see the cardiologist, but now you know you need to cut back on your sugary drinks. Now you need to cut back on all that turkey and dressing and mac and cheese you were going to eat for Thanksgiving, because you're aware of what's happening with your heart health. That's where I see my role, not just in being a good doctor, but really being a good citizen of the community.
I love that, a citizen of the community. And you bring up something really key, because in the U.S. we have, weight is really something that we are working with. But when it comes to obesity in children, how do you work with the children so that they can develop healthy habits? Of course, you have to square it with mom and dad, but how do you get the kids involved in understanding that this is what this means for your life?
That's an excellent question because it can be a challenge, right? When you're thinking of little ones, the first place I start is with the adults in their lives. What role model are you providing for this child? What healthy habits are they watching you do before they start them on their own? Because children will do what they see far more frequently than they will do what you say, right? And if you say don't drink sugary drinks, but you're tossing back 3 sodas a day, what example are you setting?
Right.
So the first thing I do when parents bring their children in to see me for weight management is I get in their business. And I ask, let's talk about what's happening in the house. What are we eating? What are we drinking? How are we exercising? How are we sleeping? So that the parent creates the framework by which the habits are changing for their children. And then we talk to the little ones about, okay, talk to me. What does health mean to you? They'll define it for themselves. And I'll say, okay, based on your definition, how are you being healthy? Because I used to teach elementary school before I went to medical school. And they'll explain to me what they're doing to be healthy. And I said, now what are some things that you think you can work on to make your body healthier? And then they'll come up with some, and they'll say, well, what, the parents will say, well, Dr. Hancock, she drinks juice, she does this, she does that. And I say, well, as a doctor, I recommend fill in the blank here. I recommend this much sleep. I recommend this much, no more than this much sugar a day. Do you know what happens when you eat this much sugar? And we start to talk about things that are meaningful to them. If it's specifically a weight issue, I link it not to a chronic disease, because an 8-year-old, diabetes doesn't mean anything to them. It has no value. But what's going on in terms of your health that may be impacted, particularly for those little ones who might be athletes? How is your weight impacting your ability to get on the football team? How is that impacting your ability to go to fill in the blank clothing store and get your outfit? Because then when you link it to something that they desire, it makes it more tangible for them. And I also don't use weight as my issue, because the last thing you want to do is make a child feel uncomfortable about their weight. And then you create other issues of body image and eating disorders. So we keep it specifically to health and health habits. What are some of the health habits we can establish together today? I need you to give me a physical activity and exercise health habit and a nutrition health habit. And I give them a menu to pick from. What do you want to work on this week? I'm cutting back on my sugary drinks. How many do you drink now? So I take them through SMART objectives. I'm all about multitasking and educating. We're going to talk about what's called a SMART objective. A SMART objective is smart, measurable, et cetera, et cetera. So talk to me. How is this going to be a SMART objective? Okay, I usually drink 2 juice boxes a day. I'm going to go down to 1. Well, what are you going to drink in this place? I'm going to drink water. How much water? When do you drink your juice boxes? So it's going to be a juice box at lunch and water at dinner. Cool. And then I write it out on a prescription. And then I give it to them. If they live in separate households, they get 2 copies. One for mommies and daddies, or one for mommies and grandmommies. Whoever's connected to that child knows what's up, because I've written it on a prescription. And then I follow up with a text message, a phone call, or something, so that they know that Dr. Hancock is in the space coaching them through these behavioral changes. One of my adult patients came in to see me for weight management and happened to bring her daughter. Well, her daughter, 2 weeks after that, said, Mommy, you're not exercising. We need to get going. And she motivated her mother to stick with what her mother had agreed upon. And so I text the daughter to tell her how proud I was of her. And her mom called me in tears. She said, you don't know how long I have waited for my child to be interested in exercising. But based on her interaction with you and the fact that you took the time out of your schedule to send her a thank you text, she said now she's committed. She's all in. She's pushing me to be better. So thank you. So it's fully a family affair. And then I do things like teachers do. Go to Dollar Tree, get a poster board, and make a sticker chart. And then whoever achieves their health goals the most that week gets to be the chief nutrition officer or the chief physical activity officer of the week or month, and put some skin in the game with a little prize. Not food related, but you get a Fitbit, you get new sneakers, you get a new workout outfit to make the children interested, because we're driven by reward. And although people will push, because Dr. Hancock said so, to stay committed to it, there has to be that little bit of a carrot that keeps them going. And that's how I do it.
Right. And now, as a teacher, now it completely makes sense. It completely makes sense. But yet you want to see some type of reward. And for kids, I mean, now we're so connected to just media.
Right.
And so to have a kid, that switch, turn on in a completely different direction is, that's amazing.
Thank you.
It's amazing. And we had talked a little bit before. Talk to me about health and policy
Sure.
when it comes to, well, we're going to talk about children because you're a pediatrician, but really for everyone, because, you know, we talk about healthcare being a privilege, and we know it's a right, but talk to us about policy and how that
Sure.
how that comes into play.
Well, I have the honor and privilege of being the consultant to the Board of Health here in Prince George's County, so I get to practice what I preach every day, right? Getting to work closely with the County Council in our goal of having health in all policies, and having a clear understanding that whether it is specific health policy, zoning policy, any policy related to community development has health in it, based on what's called the social determinants of health. So health is defined by where you are born, live, work, play, pray, and learn. So where you work affects your health, where you're educated affects your health, etc. And the decisions that our policymakers make determines the access of health that we have. How many fast food establishments are zoned for in our community? What's the green space look like? What's the walkability of a community? When you decide to expand Route 301, are you adding in a bike lane so that I can go from Bowie to Upper Marlboro without risking being injured? I always use 214 Central Avenue as a perfect example. Our children risk limb and life to get to Six Flags because there are no sidewalks on 214, there are no crosswalks on 214, and people are allowed to drive 55 miles an hour. There's health in the policy that decided that that's the speed limit that would be allowed and the kind of street structure that would be built. And so part of the work that I do in Prince George's County and have had the pleasure of doing in Washington, D.C. is helping our local officials, our policymakers, make decisions that are driven based on the impact that it has in health. As an example, in DC, I'm working with 2 of the councilwomen on legislation around sugary drinks. DC is passing a sugary drink excise tax that provides a 1.5-cent tax, an excise tax per ounce of soda. So if you're buying a 20-ounce bottle of soda, it'll cost an additional 30 cents. Studies have shown, because Philadelphia did something similar a couple of years ago, they had a reduction in sugary drink consumption by almost 40%.
Wow.
By almost 40%. That's game changing because one sugary drink a day increases someone's risk of diabetes by 26%. For men specifically, one sugary drink increases a man's risk of heart attack or dying from a heart attack by an additional 20%. So when you decrease a population's consumption of sugary drinks based on policy by almost 40%, you're saving lives through policy. And when politicians really think about there being health in all policies, that should be at the forefront of their minds. When I decide to allow a shopping center to be built, what kind of stores am I going to allow in this community? Will it be more fast food restaurants, liquor stores, or is it going to be green spaces, healthy food options, and the like, right? When we support our health care administration, and right now we're in a perfect space in Prince George's County. We have the University of Maryland coming in, building out a new hospital, the replacement of a hospital in Laurel, a merging of doctors in Anne Arundel to create luminous health systems. We have a perfect opportunity for policy to facilitate what foods are being served in these spaces, both in terms of the outpatient when we go in for just a checkup or to see our doctor for a subspecialty visit, but also in the inpatient side. It blows my mind that we will serve the food to a patient in the hospital that's killing them. We will give them a sugary drink, fry up some chicken, and put some mashed potatoes on the plate, but we're treating them for hypertension. Like, what sense does that make? When we create policy, it becomes this huge, overarching, far-reaching impact in terms of health. And that's one of the reasons why I'm driven in working with our local politicians to make sure that there is the consideration in health in all policies. And I can tell you here in Prince George's County, the County Council has done a phenomenal job in taking health into consideration, as has County Executive also Brooks. Like, it's giving me all the warm fuzzies to see where their priority areas are and the decisions that they're making in support of health for the county, for the residents of Prince George's County.
And what are the priorities for us now?
So we're looking at youth. I know for both the County Council, we're looking at healthy youth, right? There's plans in place to make Prince George's County a child friendly county, meaning that children will have access to care. We take into consideration in the educational environment, how are we creating safe space for education for all of our students, regardless of their capacity and their needs. So for our children who are dealing with disabilities, learning disabilities, for our children who don't plan on going to college, what are the other options for them? In terms of our Education and Workforce Committee as part of the County Council, they're really looking at how do we diversify the student experience so that students don't feel like if they're not going to go to college that there isn't another option. Right. I think that that's an absolutely brilliant strategy. We're looking at business, building up business, but in a way that does not impact the health of the county, being specifically targeted in addressing food deserts here in Prince George's County. What food establishments will we either fast track in terms of permitting? How will we pay attention to the landscape so that we're not putting in place the same restaurants that are causing our health statistics to position us? You know, my goal right now, we are 11th in our county ratings of the 24 counties within the state of Maryland. My goal for the county, I'm sure the county executive's goal for the county, as well as the county council, is for us to break that top 10, so that we are in that top 10 ranking in within the state of Maryland. We can't say and rest on our laurels that we're one of the most affluent African-American counties in the country and not have the same health statistics to back it up.
Absolutely, and that's the one thing, and not just because it is a political season, and you know there's so much money that's here, and we need to see it in education and in health care. And I'm glad that you say that we just can't say that, okay, this is one of the wealthiest in the nation, because what are we showing for it?
Exactly. If we are one of the wealthiest in the nation, then it should also mean that our health statistics are reflective of it. But I think a lot of times we get so comfortable in that wealth space that we don't pay attention to the health space. And I always say you cannot talk about black wealth without talking about black health.
Absolutely.
We just recently lost the CEO of Kaiser Permanente, likely due to a heart attack. He's had a history of heart disease, had a previous heart attack, and recently passed away in his 60s. When we have those kinds of disparities, when a man is cut short of his life by a good, in my personal opinion, I think we should all live into our 80s to 90s. But when we're dying that early, that impacts the family, it impacts the community, because the gift that he had been giving us as the leader of Kaiser, and I'm sure the impact that he had on his family, is now taken away. And then that causes further stress. And we see that same situation playing out in our county because we're so driven. We're one of the most successful. When we look at all the districts within Prince George's County, we handle our business in terms of education and economic achievement, but sometimes at the cost of our health. And I think when we make the healthy choice, the easier choice, where our community is aware of the resources that we have available, and we put our money where our mouths are in terms of prioritizing health and making it easier for our community to access those resources, then you start to match the health with the wealth. And it's conversation, we just had our last Board of Health meeting for this year, and that was one of the topics of conversation, is how do we truly put our money where our mouths are. The County Council commissioned a RAND study to look at health and human services here in Prince George's County to see, one, where our priorities should be based on the data, and two, where money is currently being spent to see if there's a match or a mismatch. And then it helps to direct the County Council in what they need to do in 2020 and beyond to make sure that we are filling in and achieving the health that we desire, so that the efforts that they're putting forth to put health in all policies is paying off.
Wow, and how do you get the community involved? Because we don't know that this is going on. So what's going to be the rollout so that the residents know this is what's coming, this is how we can help? How are you going to let us all know what's going on? Great
question. So couple things. One, the RAND report will come out in January, so be on the lookout for that. I think it's important to stay connected. So there's the County Council newsletter. I think it's important to know who your County Council member is, because then you can meet with them directly, have conversations with them to have a clear understanding of what their priorities are for your specific district. There are 9 districts here in Prince George's County. There's no excuse as to why you should not know who your district representative is. And then when you sign up for their newsletter, the county council newsletter, the county executive's newsletter, like I get all the newsletters, right? All of it. Because for me, knowledge is power. The information is available, but you have to do your part in accessing it. No one is going to spoon feed you. And I think a lot of times, whether it be in medicine or in community engagement, people expect folks to just come to your door and be like, hey, this is what's happening in the county. No, you have to put forth effort. When I didn't have the position of being the consultant to the Board of Health, I was at every coffee and conversation. I was at every legislative listening session that Rashawn Baker held, because one, I wanted to know what was going on, and two, I wanted to make sure my voice was heard. And I had a 3-minute testimony written at every single interaction. So much so that I had a 3-minute testimony written for this administration under County Executive Alsobrooks, only to find out 2 minutes before I was about to give testimony that I couldn't as the consultant to the Board of Health. So luckily I found that out right before I stepped up to the mouth. Because luckily for me, my inner spirit was like, check first, because something tells me this ain't right. So I was like, hey, can I give testimony? They were like, no, you cannot. You're now a paid consultant, go sit down. I'm glad I asked, but I was ready, and that's the thing. Stay connected. Follow them on social media. I know that every county council member and county executive Alsobrooks has a Twitter account, an Instagram account, and a Facebook page. The information is there. You just have to avail yourself of it and make sure that your voice is heard. Do not sit passively by and then complain that things aren't happening. And then when you approach them again, it's same with a doctor. When you do it in a conversational, mutually respectful way, you get answers. But when you come with oh, politicians are all the same and they're just gonna do this and that, don't be that person. Go in there with some specific questions and be ready to have a conversation and to be in a position of listening so that there's truly a dialogue that happens, and then you will get the information that you need.
I mean, I'm excited. I know we were talking about you just being here and what it's like to be a pediatrician and what our kids are looking for and what they need. But the policy part of it, when you mentioned it, I was like, this is what we really need to know. Because if you don't know, you don't.
If you don't know, you don't know.
And so if it's not out there, then you just don't know where to get that kind of information. And so thank you so much for that, because policy is not just it's national. It's not just even local. And can you talk about what's going on nationally?
Sure. So one of the biggest areas of policy is universal health care, right? So President Obama, love me some 44. Can we? All right, I'm good now. Okay. Shout out Obama. So President Obama, with the Affordable Care Act, the way that it was initially envisioned was to provide universal health care coverage. But because big insurance is a huge lobby in the federal landscape, that wasn't going to happen. Between everyone and their mother on the other side trying to block every single initiative that he tried to push forward, and pairing that with one of the strongest lobbies in the country, the insurance companies, there was huge pushback in terms of creating a universal healthcare space. We know that having insurance linked to your employer does not work, because employers can be very creative in how they take away the ability to have insurance coverage. We saw that recently with Amazon, right? Amazon, as much money as this man makes, made a decision that he would no longer provide his part-time employees with health insurance coverage, which makes no sense to me, because if you insure people, you increase the likelihood of them maintaining good health, and then you maintain a good, healthy workforce. But when you're short-sighted and money is more important than people, then you get those kinds of decisions. So right now, between Bernie Sanders and Elizabeth Warren, there's this huge push for Medicare for all, because it allows for us to use a system that's already been in existence in the way of Medicare, but apply it to every single person who lives in the United States, regardless of their citizenship status. Because when we start talking about folks who are here illegally, it isn't as if they're not using medical services. They are, except they're using the emergency room, which costs the country more money. So you end up cutting your nose off to spite your face. And when you instead consider a program like Medicare for All that creates a foundation by which I can practice medicine, there's a clear-cut transparent way in which I'm going to be reimbursed. It isn't based on state-to-state reimbursement rates. Because if I practice in Maryland, my reimbursement rate is going to look different than when I practiced in California. My reimbursement rate here is actually less than if I had practiced in California. Even in DC compared to Maryland. DC reimbursement rates are higher than they are here in Maryland. And there's no rhyme or reason to it, and they don't have to explain it to us. But if we take the middleman out and create a space where the government says I'm paying $50 for a well child checkup, whether it's in California or in Maryland. Now you can throw in the bells and whistles if you want to, Dr. Hancock, but all you're getting is $50 for X, and if you do X, Y, and Z, it's very transparent. Also, when you go to the hospital, if you're admitted, there isn't this guessing game once you get out as to how much your health care is going to cost you. There's nothing worse. My mom was in the hospital not too long ago, back in March. We kept getting hospital bills over and over. I think she got like 15 different bills.
Yeah.
And they charged like $50 for some gauze. Like, I'll bring the gauze. I can get 2 for $5 at CVS. What are you doing? Like, save your gauze. Where is it laced with gold? Like, what's going on? But because we don't know until after we've been discharged, having a system like Medicare for All takes the guessing game out. I don't have to sit on a phone for 30 minutes trying to pre-authorize a medication that was covered last month. And that's happened. I had a child come in with an asthma attack. Prednisone is a standard medication for a child who has active asthma. I've been writing prednisone for 15 years. But the insurance company decided, we're not covering it right now. So now I give them on the prescription. She goes to the pharmacy. It's like $4.45. Pharmacy says, your medication needs to be prior authorized. So then I get on the phone with the pharmacy. I said, that doesn't make any sense. I just wrote prednisone last week, and it was covered. She said, not for this insurance company. So now I've got to call the insurance company and hope to get someone on the phone between 4:50 and 5 o'clock. And I still had patients. So patients had to wait while I was on the phone. And of course, by the time I was rolled over into the phone tree, now I get the answering machine because now the office is closed. So now I have to send this mother to the emergency department to get prednisone. Now, what could have been a $2 copay turns into a $1,200 visit because of bureaucracy. And if we have a system, some sort of universal healthcare system like Medicare for All, it takes the frustration out of what I have to do. Instead, I can just see patients. I don't have to be on phones with insurance companies. I don't have to navigate and negotiate prior authorizations. You know what you have to pay for what, and you know what's covered, and it's very straightforward. That's the system that we're starting to work on. We're pushing to have that passed. We'll see what ends up happening, particularly as we're entering into this election year.
I am so, when they talk about that, because they're doing a debate tonight, I didn't know that's exactly what that meant for Medicare for All, because I'm tthinking, how's that ever going to work? Because you want your doctor, you want to keep your doctor, but we're going to have to talk about that some more.
Yes.
We have just a couple minutes. Tell folks how they can reach you.
So you can reach me on social media at Ask Dr. Yola on Instagram and on Twitter. On Facebook, you can find me at Dr. Yolandra Hancock, and my website is askyola.com.
I love that, askyola.com. So we're going to have you come back.
Definitely.
Because the Medicare for All, I mean, that's for adults, that's for children, is something that we definitely need. And here we have an advocate for Prince George's County, Dr. Hancock. Thank you, and thank you all. We'll see you next time.